Here. And for those that may not know, my name is Dr. Valerie Frazer, and we're going to be talking about visual skills for reading. I'll go ahead and get started here. So first off, I always like to say, like, why talk about vision and reading? Well, 25% of children that have vision problem or have vision problems that can interfere with learning. And 73% of reading or labeled reading disabled children have binocular vision and or visual processing problems. So the problem is more widespread than we think about. I always like to start these by kind of going over what might define good vision, or oftentimes we think about good vision as being 20/20 eyesight. But just like hearing and listening are not the same, eyesight and vision are also not the same. So what does 20/20 vision mean? So it means that you can see a certain size letters uh, at a 20 feet away. So the first 20 is the distance you are from the target, and the second 20 has to do with the size of the letters. So if you're 20/50, that means the letters are going to be that you can see are bigger. 20/20 are going to be smaller letters, and then 20/10 would be kind of the smallest. But it's a distance test and it doesn't really tell us much about how things could be looking at near. So these are some examples of what it might look like if you have a problem that would affect reading from a vision standpoint. And oddly enough, a lot of people, when they get their eyes checked, a lot of us think, well, I need eyeglasses if I can't see well, but needing glasses for distance is actually not associated with reading and learning difficulties as much as needing glasses for near. So many kids can pass vision screenings, they can see 20/20 at distance, but require glasses or need more assistance with vision therapy to get their vision working better at near. So what are some of the visual skills that are required to learn and read? The top three that I like to talk about today are eye teaming, eye focusing, and eye tracking. And we'll kind of go through each of those and how they can affect reading. So eye teaming is creating a single picture from, you have two eyes, each eye has this kind of its own input, and they need to be pointing at the same place at the same time. If they're not, things can run together. They can look double. They can look like they're moving around the page. If it can be really hard to look at, and you just need to sometimes look away or take more frequent breaks. So not everybody has the same symptoms, but some will get double vision. Often it's intermittent. Sometimes it'll just be like the words moving around the page. Sometimes eye strain, fatigue, and headaches. You can see a lot of rubbing of the eyes or blinking a lot, trying to focus the words. Again, the print can move around or wiggle around the page, or you might have try to compensate by covering one eye or tilting the head, or like this girl is, she's putting one head down on the table. In that case, one eye kind of gets blocked out and they're only using one eye to read. The other important visual skill are the visual focusing skills. So in each eye, there's a lens um, that when you look far away, it will relax to see clearly. And when you look up close, it has to do some work. Now, that system develops pretty well by about 4 months of age, but starting in adulthood, it starts to decline. So usually by age 40, we need readers to be able to see clearly up close. That usually levels off sometime in your 60s. But that's why people go to reading glasses and bifocals. But in a kid, it should be easy and automatic. It should be easy to switch focus from near to far. It should be easy to sustain that focus for a long period of time. But if that's not working well, then what we get is blurred vision or intermittent blurred vision when reading. It might feel like their eyes have to work to focus on the page. Again, you can get the eye strain, headache, fatigue when reading and writing. Uh, you can have difficulty reading smaller print, or even transitioning into chapter books can be more difficult. Difficulty with attention. So all that extra effort, either from the eye teaming not working well or the um, eye focusing not working well, makes it harder to keep your attention on reading and writing tasks. And for some, if you've been working those eyes at near for a long time, sometimes when they go to look up at the board, then things can be blurry at a distance. So you can think about like almost like a muscle spasm where it doesn't fully relax to see clearly at far. So sometimes they'll complain, well, the board is blurry, but it actually has to do with what's going on up close, not necessarily what that they need glasses for distance. The third important eye movement skill that we're going to talk about today is what I call in general eye tracking. So that's the ability to track and follow our eyes. It includes two major eye movements. So one is just following a moving object, and the other is pointing your eyes accurately from one point to another. Of course, if you have poor eye teaming skills and poor focusing skills, that also can interfere with eye tracking. So if we look at the eye movement skills needed for reading, we call those saccades, or if you're from England, saccades. Um, but as you can tell from this video, if your eyes are moving around and not moving accurately from one place to another, it can cause difficulty with keeping your place when reading. So for difficulty with saccades, we often see loss of place when reading, the need to reread information, slow reading, and poor fluency. Sometimes the words get out of order, or sometimes even the letters, or missing small words. With pursuits, following the difficulty with following a moving object, a lot of times that affects your kind of coordination. You might seem a little bit more clumsy and more difficulty with sports and difficulty catching or tracking a ball. But of course, if you put all those together, and oftentimes I see all three, of those visual skills are not well developed, you can get not only the physical symptoms, but also some behavioral issues. So bad homework becomes a battle. They often say, I can't before trying. You get a lot of avoidance behaviors, avoidance of reading, frustration, anger. Sometimes they're labeled with ADD or ADHD. Sometimes they're labeled as maybe a little lazy. But most of all, I mean, they're just failing to meet their potential because their eyes aren't working the way they should. And most kids don't recognize that these problems aren't how everybody else sees. They don't realize that words shouldn't be moving on the page. I've even had adults who said they didn't know that was their eyes causing that, or that's not how other people see. They just knew that reading was really frustrating. So what can be done to improve these visual skills? So vision therapy is the most proven treatment to treat these visual skills issues. It's a progressive program, meaning that we start out where you're at and then we make it harder and harder to make it more automatic and make sure that I always call it the riding the bike stage, where things are easy and automatic and you don't have to think about them. It's individualized for the patient, again, because we're starting where you're at and then changing it as we go along based on how you improve. And again, it's designed to remediate and enhance those visual skills that I was talking about, but also we often work on visual information processing at the same time. A lot of our therapy, or what separates us from other, let's say occupational therapy or physical therapy that sometimes work on certain visual skills, is that we use a lot of lenses that change how the focusing system has to adjust, lenses that change how the convergence system has to adjust. or lenses that help us utilize more of your 3D vision. So depth perception or 3D stereo vision, sometimes it's called, is one way that we know whether or not the two eyes are working together, because the only way to get that stereo vision is for the two eyes to actually meet in the same place at the same time. Vision therapy success rates are really high. In one study, it showed that 75% of patients with convergence insufficiency showed a significant improvement after only 12 sessions and maintained that improvement. Most of our therapy programs run between 12 to 24 sessions. Um, Oftentimes, when you have all three areas that we're working on, we need about 24 sessions to get things working the way that they should long term, especially in kids. We don't want to have them go back and revisit these problems later in life. And then who provides the vision therapy? So there's when I graduated from optometry school, there was only one certification program. It was formerly known as a fellowship in an organization called COVD, which just recently changed their name. So it doesn't sound like COVID to OVDR. So I'm a fellow of optometrists in vision development and rehabilitation. There are other programs that exist now for called the Optometric Extension Program has a fellowship program, and the Neuro-Optometric Rehabilitation Association. The last one primarily is working with patients with brain injury. I'm a member of that organization, but my fellowship in the OBDR kind of encompasses all ages. So again, this is kind of just a short summary of all of the three visual skills